Welcome to ECG Challenge number 7. Please use 7-step approach for systematic analysis. You will see many images of the same ECG. Pause the video if you need more time. Let's start. This ECG belongs to a 68-year-old male who presented with history of palpitations and dizziness. The correct answer is atrial flutter. This is a form of supraventricular tachycardia with atrial rate of 250 to 350 beats per minute. It is characterized by flutter waves or sawtooth waves on ECG. These changes are prominent in leads 2, 3, AVF, and V1. Atrial flutter is commonly associated with atrial fibrillation, and sometimes ECG may fluctuate between these two rhythms in the same patient. Unstable patients with this condition should be treated with emergency cardioversion, whereas rate control and treatment of underlying condition is the first line of treatment in stable patients. Thanks for watching. Please like and subscribe. See you again in the next ECG challenge.